Okay, well, good afternoon, everyone. Welcome to our May 8th daily video between the city and the county to update folks in the community on efforts relative and surrounding COVID-19. Today, I'm Dave Strohmeyer, Missoula County Commissioner, and today we have with us my co-host, City Council member Gwen Jones, and our Director of the Office of Emergency Management, Adrian Beck. Today's topic, Sleepy Inn. So as I think everyone knows, there's been a fair amount of vigorous discussion as to what is going on with the Sleepy Inn and its purchase and operation by the city of Missoula and Missoula County. This week in particular, folks have been seeing a flurry of activity and work going on at the facility. So we thought it would be timely to have a bit of an update as far as what has gotten us to this point today and where this facility, which is also referred to as a non-congregate shelter facility, might go into the future. So I guess just to kick things off, Adrian, do you want to just bring us up to date and review for us a bit of how and why this facility was purchased and how that work has played out relative to our relationship with FEMA?
You bet. So as this pandemic has unfolded, not only in the U.S., but globally, local jurisdictions have had to respond and take measures to prevent the spread of the communicable disease within our communities. And because of the scale and scope of this particular pandemic, the president declared a nationwide emergency. And what that does when the president declares an emergency, much like any other disasters, is it calls on FEMA then to assist local governments and states in their local response by way of federal assistance. And you don't really access federal assistance until you have that presidential disaster declaration or emergency declaration, which we're operating under. Because of all of the some of the challenges with how we respond to COVID-19 to protect our community, to protect individuals, and ultimately to prevent a wave of really sick individuals going to the hospital, the notion of isolation and quarantine is kind of central to our response. In light of that, FEMA recognized very early on that many communities lacked the ability to provide facilities for individuals to be able to perform those isolation and quarantine duties to prevent that spread. And so very quickly they came out with guidance around this notion of non-congregate sheltering and made federal assistance available to local jurisdictions to access federal funds to provide non-congregate sheltering within their communities. By early March, we had a pretty clear indication that we were going to need federal assistance for non-congregate sheltering. And in fact, we're in a daily struggle to access shelter locations for individuals that needed to isolate or quarantine per a health officer's order.
Great. And could you, before we go on, could you just define for folks the difference between, and it's probably obvious to all of us on the line here, but difference between congregate versus non-congregate sheltering?
Sure. So congregate sheltering, congregate housing is much like you would see in a group home setting. Oftentimes when you think about FEMA disaster shelters following a hurricane or even in a large fire situation, you think of the large auditoriums where you have individuals on gym floors with cots. The nature of this disease and how it is spread just does not make that feasible. And so individuals that are in a quarantine situation who have been exposed but are not yet presenting symptoms, but still very much could be contagious, cannot be co-located with other individuals. And so the need to be able to provide them not only with their own private room, but own private bathroom makes that sheltering a bit of a challenge.
Great, thanks.
Thanks, Adrian. And I do remember from the numerous weeks at the beginning of this pandemic, it was a daily scramble to find those hotel rooms to put people in. So it may sound easy to do, it was not easy.
It's not easy to do, and actually, I would follow up on that. In that that daily struggle and not knowing how long the duration of this event would last really led us down the path of how we could be successful and how we could plan for the future and know what our capabilities were at any given time. And that really is what led us into the conversation of we needed to have a facility that we had some expectations around and that we could have control over. And so the notion of having a facility that was in government control, so to speak, really became our focus, and looking for a facility that kind of checked all of the boxes of what we needed, the criteria that we needed per the health officer's order to provide adequate shelter for individuals.
Much more workable situation, I think.
Absolutely.
So could you speak a little bit to what work is going on there today, and when do you expect that to finish?
So immediately after the City Council approved the purchase of the Sleepy Inn, the city and the county entered into a memorandum of understanding for the lease with the Office of Emergency Management. And the reason that the lease is with our office is that I mentioned FEMA before, and the Federal Emergency Management Agency, FEMA, when they provide federal assistance, it's through our office. And so the lease, being the leaseholder, made the most sense because we are the ones with the direct access and the direct connection to FEMA. So once that lease was executed, we began work immediately with contractors, volunteer organizations, the health department, to make sure that we had a good plan for how to bring the site up to the conditions that we needed them to be in for appropriate use as non-congregate sheltering. And I want to give a shout out to Team Rubicon. They are tremendous. We have leaned on them through many disasters, and this is another one where they stepped up to the plate. They came with a force of volunteers and were able to dispose of all of the furnishings that we were not going to reuse for this purpose, as well as to rip up carpet to make it all that much quicker for the contractors to come in and lay new flooring and get the site up and operational. As of Wednesday, we had 4 rooms that had been kind of transitioned and were suitable for use, and today we stand at 8.
Great.
The work is ongoing in that we've always looked at this as a phased approach, in that the rooms that were quickest and easiest to get turned around were our first priority, to create kind of an inventory of rooms so that we could create some of those planning assumptions and begin our planning cycle so that we were able to react in a better fashion when we were asked to provide shelter for individuals. But our expectation right now is that, additional rooms will come online daily, and then we hope to have the entire facility kind of suitable for our use by mid-May.
Excellent, thank you.
Yeah, so Adrian, I guess related to the work that's going on right now, it makes me think back when the health department inspection report was made public here recently, and I certainly heard from many constituents concerned that are we going to be able to mitigate some of these issues that were raised in that inspection report and put folks in a safe and healthy environment, folks who might actually be sick or were concerned that they could be sick. So could you talk a little bit about the efforts that are going on right now to mitigate some of those concerns or conditions that were identified by the health department previously?
Yeah, absolutely. And I will mention that we, working closely with the health department, sanitarians, as well as the health officer, to really take a look at what needed to happen there. And so we were able to hire professional pest abatement and do mitigation to not only deal with the short term, but also the long term. Determination was made that it would be easier and better to remove all of the soft bedding material, as well as the beds and the carpet, and replace it with surfaces that could be cleaned and on an ongoing basis. And so we're confident that we have taken the steps necessary to make the facility suitable for use for the non-congregate sheltering that we're going to be doing there.
Fantastic, thanks.
So my understanding with this non-congregate shelter is that this will be a facility where people who have symptoms or are positive, they're either pending testing or they're positive from testing, will have an opportunity to stay isolated and quarantine, and also that others will not come in to visit them necessarily. The whole point is to try and contain this virus. Can you speak a little bit to security? How will we secure the facility for the people that will be staying there?
You bet. So if you were to drive by there today, you're going to see probably not a very attractive construction fence, which was born out of necessity in that while we were doing work on site, we had public stopping by, as well as just individuals kind of wandering into the site. And while we had lots of rooms open, we did need to kind of treat it somewhat like a construction site. So we did throw up that fencing to ensure that nothing was going to walk off the site and that we could maintain that security. But additionally, we have staffing on site for 24/7 in anticipation of occupants, and we also have 24/7 security, not only to protect the individuals that are there being housed at the facility, but also to ensure that we provide protection to the community as well.
Thanks.
And besides the security concerns, Adrian, could you talk a little bit about just from start to finish how this facility will be operated?
Sure. So I mentioned that we have 24/7 staffing model currently in place. And that is really to ensure, similar to when you're at a hotel, that if you call the front desk and need something, that we can address those. The site does have functional laundry services on site, so we anticipate doing most of those things and having the operation be pretty much contained within the facility. But food and water will be provided to all the occupants for the duration of their stay as well. And we're working not only with volunteer organizations such as Meals on Wheels to coordinate that.
Good.
And so on that same line, could you speak to what this facility will not be used for? Because I think there's been some questions in the community about that.
Sure. So we are dealing with the federal government, which means that we have a lot of I's to dot and T's to cross to ensure that we follow all their guidance. FEMA is very specific in that this notion of non-congregate sheltering and using funding from the federal government to operate non-congregate sheltering, it needs to meet very specific guidance. And furthermore, it cannot be used for other purposes. So one of those explicitly is that being homeless alone does not qualify someone to stay at non-congregate sheltering. They have to be exposed to COVID-19, tested positive for COVID-19, or fall into another category of individuals that is very specific relative to their risk for COVID-19. And so if you don't meet those three criteria, non-congregate sheltering is not appropriate for them. And in fact, we cannot put them into the site. The other piece of it is that, a lot of people express concern about individuals that are sick with COVID-19 being placed at the facility. The facility is not designed to be a medical facility, and in fact cannot be a medical facility in any way, shape, or form, and no medical care will be provided on site. If individuals who are residing there need medical attention, then they will access that through the traditional means, either by going to see a physician or by accessing emergency care through 911.
Thanks.
No, that's super helpful. So just to be clear, this is not a homeless shelter. So
correct.
If folks are thinking this is just an extension of the POV, it is not. There's a specific public health related connection to what is going on here. Yeah,
and I would add on to that, Dave, sorry, is that the other piece of it too is that an individual getting kind of checked into non-congregate sheltering requires a health officer's order. It's not just any provider can make a recommendation for someone to access the site. It really does have to go through our kind of established protocol through the health officer, because the non-congregate sheltering really is at the health officer's direction and her request.
Yeah, that's important. So pretty basic question here that some folks watching might be thinking to themselves, why do we still need this? We've done a pretty good job of flattening the curve here in Missoula County, which is fantastic. Thanks everyone out there who have socially distanced and taken health officer orders seriously. But why do we need this today? And what would be the triggers that we would identify for shutting this down at some point in the future, at least as a non-congregate shelter?
Well, I think that to answer your question and why we need this today, it's the same reason that we all need to maintain social distancing amid COVID-19 as we kind of go back to our, quasi-normal lives. The virus and the threat of the virus has not gone away, and it by all measures will not go away for some time. We are but a case away from having another situation where we could have community spread. And so we need to maintain the site for at a moment's use amid this disaster. And in fact, within 24 hours of having rooms becoming kind of operational for us, we've had to put them to use. So it is in use today.
And I guess looking ahead to the future, just to build on the need for this facility and what it might, what the property and site might hold for future years. Gwen, do you want to talk about that from the city of Missoula's perspective?
Sure, I can give you some information on that. This purchase of the Sleepy Inn there was a lot of thought that went into it. It may have looked like it happened really quickly, but in fact, for years now, through the Missoula Redevelopment Agency, the city has been looking at the West Broadway corridor for specific land acquisition because we have an affordable housing issue in this town and we need to build some affordable housing. So for years we've been looking at areas, and this is within the URD number 2. So we have that tool to try and acquire land. So we're looking at, in the future, developing this property as a bottom line. We have a housing policy that was authorized a year ago that specifically says this is exactly the type of step we need to be taking. We need to be purchasing land because they aren't making any more of it here in Missoula. So we need to try and get in on it. And this West Broadway corridor, where the Sleepy Inn is located, is an opportunity zone, which gives us an excellent financial tool to try and get the private sector to come in and have a commercial component if this parcel is developed. It's also in a qualified census tract, which not every area of Missoula is in a qualified census tract. By being in a qualified census tract, it means that we can apply for low-income housing tax credits, which is yet another tool to try and develop affordable housing that will be below market rate. So all of these pieces came together with the Sleepy Inn, and in the long run, in 1 to 2 years after this pandemic is ancient history, we hope to redevelop it. Or it also basically could be a tool in terms of land banking to take this and swap it for other property also within this area that would be even more strategic. So it gives us a great tool. And Adrian, I think the one last thing I just wanted you to speak to briefly is the fact that FEMA is basically financing not only the cleanup and the operation, but also a daily rental rate. So this is nice that it's always better to own than rent, of course, and the city of Missoula is in a position where we are getting that daily rental rate of close to $1,700 reimbursement every day on this property. But can you talk about those fact that FEMA is footing the bill on cleanup, the operations, but also what the future looks like in terms of future FEMA funding for this?
You bet. So yeah, the city is the landlord and Missoula Office of Emergency Management as the tenant are paying a lease for the exclusive use of the facility for a non-congregate shelter. Obviously, we wouldn't want to be co-locating or renting out rooms for other purposes. So that really is, again, justification as to why we wanted to have an entire facility there. The costs from FEMA are reimbursed at a 75% rate, and then the state of Montana is actually picking up the remaining 25% tab. Eligible costs include anything that we need to outfit and or operate the shelter, including that lease payment that you mentioned. FEMA is looking at these non-congregate shelter approvals at the state level every 30 days. And so we are actually operating under the state of Montana's non-congregate sheltering plan that is approved by FEMA. The 30-day snapshot, we came into the Sleepy Inn when we were about halfway through that period. And so that period actually does expire on the 10th of May, which is Sunday. And FEMA is being pretty quick to turn around those extension requests or a new 30-day approval period. We have not yet heard on ours, but in talking with the state of Montana today and in talking with other states that are actually a couple days ahead of us, FEMA has given the indication that we need to operate under the assumption that they will be renewed for the next 30-day period.
And to just follow up, they don't necessarily make that decision just based on what's happening in Missoula or the state of Montana. It's more of a national scenario and we still have coronavirus in America in great numbers, frankly.
Right. There were 2 new cases reported in Montana in the last 24 hours. And I think everybody is somewhat surprised when we don't have a new case. We're very happy for that, but also just with an abundance of caution. And yeah, we're looking at this, and FEMA is certainly looking at this on the national scene. And there really are two things for our non-congregate sheltering to continue in Missoula. One is that FEMA continues to approve it and the state of Montana continues to approve it. But the third is that, the second, excuse me, is that our local health officer continues to ask for it and continues to tell our office that it is a need.
Great. Thank you so much.
Yeah, any last words, either Gwen or Adrian?
Oh, well, lots of great information today. Thank you. Adrian.
Thanks so much. I think this is a real testament to everyone who's worked together to try to be proactive in the midst of this pandemic. So thanks, Adrian. Thanks, Gwen, and everyone out there. Have a great weekend. Be healthy, be safe, and be well.
Thank you.